Hello, my name is Jeremy. I'm going to be reading from the Essentials of Strength Training and Conditioning in 3rd edition. Page 130, this will be Bone and Connective Tissue Adaptations. The selection of different forms of aerobic exercise has met with some success in bringing about improvements in bone mass. Aerobic programs that are the most successful in stimulating bone growth involve more intense physical activities such as rowing, stair climbing, running, and running with weight packs are best. The key to success of aerobic exercise is stimulating new bone formation in that the activity be significantly more intense than the normal daily activities the person typically engages in. Thus, brisk walking may stimulate bone growth in previously sedentary individuals who are not accustomed to that level of activity. The intensity of the activity must systemically increase in order to continually overload the bone. Eventually, it may become difficult to overload bone through aerobic exercise when the oxygen transport system, rather than limitations of the muscular system, restricts the progression to new exercise intensity. Bone responds to the magnitude and rate of external loading. Therefore, to enhance the stimulus to the muscular skeletal system, it is also necessary to increase the rate of limb movement. Using interval training techniques is one method of providing a greater osteogenic stimulus while still providing the benefits associated with aerobic exercise. In mature adults, the extent to which tendons, ligaments, and cartilage grow and become stronger is proportional to the intensity of the exercise stimulus, especially from weight-bearing activities. As the bone and muscle intensities of exercise that consistently exceed the strain placed on the connective tissue during normal activities are what is needed to create connective tissue changes. An example of the positive effects of weight-bearing activity on cartilage is evidenced in typical knee joint, where the surfaces of the joint that experience the greatest degree of weight-bearing are thicker than the non-weight-bearing surfaces. Complete movement through a full range of motion during weight bearing seems to be essential to maintain tissue viability. Animal studies to evaluate the potential negative effects of aerobic exercise on cartilage have shown encouraging results. Long-term adherence to treadmill exercise in guinea pigs thickens the cartilage and increases the number of cells. Running studies using dogs as subjects demonstrated that a moderate running program, 2.5 miles, per day, 5 days per week for 40 weeks, increased cartilage thickness and stimulated remodeling of bone tissue. It was also found that more strenuous running increased to 12.5 miles per session, decreased cartilage thickness, but even running 25 miles per session for 1 year or weighted running using jackets weighing 130% of the animal's weight of 2.5 miles 5 days per week for 550 weeks did not cause degenerative joint disease. Wow. All right, we'll go into endocrine adaptations. Similar to what occurs with anaerobic exercise, changes in hormone production contribute to the body's adaptation to aerobic exercise. Not only do testosterone, insulin-like growth factor, IGF-1, and growth hormone affect the integrity of muscles, bone, and connective tissue, they also help to keep metabolism within normal range. Increases in hormonal circulation and changes at the receptor level are specific responses to aerobic exercise. High-intensity aerobic endurance training augments the absolute secretion rates of many hormones, including epinephrine, in response to maximal exercise. Although trained athletes have blunted responses to submaximal exercise, their hormone concentrations equal those of their untrained counterparts at the same relative submaximal exercise intensity. The greater hormone response patterns to maximal exercise appear to augment the athlete's ability to tolerate and sustain prolonged high aerobic exercise intensities. When exercise intensity is very high and exercise duration is very short, from 5 to 10 seconds, only fight or flight changes in peripheral blood hormone concentrations occur. Epinephrine and norepinephrine concentrations increase. Aerobic endurance training, especially running, is often associated with protein sloughing from the muscle, brought about in part by stress-induced cortisol secretion that the body attempts to offset by increasing hormonal anabolic responses in testosterone and IGF-1. Interesting. Insulin-like growth factor 1. Chronic high-volume running creates a catabolic response, that can lead to muscle degradation and reduction in power. It is not uncommon for elite aerobic endurance runners who are training with high mileage to be able to jump vertically over several inches. Very interesting. Cool. So that's bone and connective tissue adaptations and endocrine adaptations, page 130, going into page 131.